In 1996, Dr. Walter Whitlett of Harvard University wrote a report in the Journal of the National Cancer Institute saying nearly 50% of breast cancer cases could be avoided if women would take certain precautionary steps in their nutrition and their lifestyle practices. In 2015, the American Cancer Society estimated over 230,000 cases of invasive breast cancer and over 40,000 deaths because of it. Too many people die or get real close to death from this disease, and it makes me wonder, did they know the symptoms for early detection? Did they take the steps to help prevent it altogether? Most of us know what breast cancer generally is and where it comes from. Early detection has a survival rate of 90%. With knowledge of the symptoms and warning signs, maybe ours and future generations can be the ones to make the current statistics reduce. We are over 40 years deep into the research of breast cancer, and with the development of medical technology, I want more people to be aware of the symptoms and learn ways to prevent it. Throughout my speech, I will describe the symptoms and warning signs, early detection through self-exams and mammograms, and prevention through nutrition and exercise. Let's first go over the symptoms, where they are, and what they might feel or look like. In the beginning, breast cancer typically has no symptoms, but as it advances and becomes a tumor, you will notice the signs. There will be a lump in or around the breast. It can even be found under the armpit. The mass could be as small as a pea and feel like a marble. For women, the lump will be persistent through her menstrual cycle. Also, any changes in the size or shape of the breast and any area that looks conspicuously different than the other. Good thing we have two so we know what looks normal and what doesn't. Even changes in the nipple can be a sign of breast cancer. Dimpling, puckering, inward facing, or change in the position of the nipple. Any blood staining or fluid coming from the nipple, but don't let this be confused with a milky substance. Changes in the skin of the nipple include redness or scaly skin. According to WebMD, sometimes changes that seem normal can be signs of cancer, and most lumps aren't cancer. That's why you should pay attention to your body. Know your body. Now let's talk about what examinations you and your doctor can do. Early detection is key. The sooner breast cancer can be diagnosed, the better the odds. You can practice self-exams in the privacy of your own home. This will help to get to know your body, and you can begin this as early as your 20s. Clinical exams are done by your gynecologist when you have your yearly checkup. Your doctor can show you the proper steps to perform your self-exams. Mammograms are done by a special x-ray. They get a better look of any abnormalities or growth in the breast tissue. This typically begins well into your 40s. Mammograms with magnification are used to see if there are any calcification in the breast tissue. Calcification is the accumulation of calcium salts in body tissue. When it deposits abnormally in soft tissue, it hardens. If there's anything that the doctor wants to get an even better look at, they perform a biopsy. A biopsy is when they insert a needle into the breast to draw out a very small portion to analyze under a microscope. Lastly, let's discuss how nutrition and exercise can be a preventative. According to Dr. James Moschino, 50% of breast cancer cases are strongly linked to faulty nutrition patterns, excess body fat, and insufficient exercise. New evidence has proven the importance of dietary and everyday tactics that women should consider to reduce the risk of breast cancer altogether. Reduce the consumption of high-fat foods, except fish. These foods are high in saturated and polysaturated fat. This type of fat overstimulates the estrogen hormones in your body. When this increase happens, the breast tissues replicate, and when the cells divide too rapidly, they can make errors that may lead to breast cancer development. Staying lean is a good way to prevent breast cancer. Women who are overweight have a 3 times greater chance of breast cancer. A New York University women's health study showed that as women become fatter, they increase their production of estrogen hormones in their fat tissue. This sequentially overstimulates breast cells. And as I said before, the overstimulated cells cause errors. Exercise is good for every part of your body. With a 30-minute strenuous exercise at least 5 times a week, this helps keep your body lean and healthy. Taking a high-potency multivitamin daily with vitamin D and E helps disrupt the production of cancerous breast cells and hinder them from forming the blood vessels that feed them. Decrease your alcohol intake to no more than 1 alcoholic beverage in a 24-hour period. Now you are knowledgeable in the signs and symptoms of breast cancer, the examinations for early detection, and nutritional facts and everyday schemes for prevention. Now that you have the same awareness as I do, let's be a part of the generation that beats breast cancer for good. Thank you.